Chapter 38 Upper Respiratory Disorders. Upper respiratory disorders can result from many different conditions, everything from the common cold, acute rhinitis, or allergic rhinitis. Things like hay fever, pollen, or just normal seasonal allergies. The common cold. Everyone gets it. It has a contagious period of 1 to 4 days before the onset of symptoms, and during the first 3 days of the cold itself. And it's transmitted through contact and touching contaminated surfaces, and then touching the nose or mouth, eyes, any opening. And it also has symptoms of the common cold, everything from nasal congestion, cough, mucus secretions, stuffy nose. Antihistamines. These compete with histamine for receptor sites and prevents a histamine response. They come in several groups. The first generation antihistamines, which usually cause drowsiness, dry mouth, dizziness, fatigue, or the second generation antihistamines that usually have less drowsiness associated with them. The first one, the one that everybody's heard of, diphenhydramine, Benadryl. This is used for things like allergic rhinitis, itching, hives, the common cold, sneezing, cough, and even motion sickness. It has contraindications such as closed-angle glaucoma, urinary retention, and severe liver disease, and can interact with other CNS depressants such as alcohol. I want to take a careful assessment of the patient, both for any environmental exposures and triggers, as well as any urinary dysfunction, cardiac or respiratory status, and keep a careful eye especially on hypoxemia and gas exchange. Give the oral form of diphenhydramine with food to decrease gastric distress, and warn the patients to avoid driving a motor vehicle and performing dangerous activities until stabilized. You should also advise the patient to avoid alcohol and other CNS depressants, and suggest things like sugarless gum or candy to deal with the dry mouth. Nasal congestion. This is that dilation of the nasal blood vessels that results in a swelling in the nasal cavity. Nasal decongestants. These take many different forms, everything like nasal sprays, such as over-the-counters like Afrin, nasal drops, tablets. Then they can have side effects such as nervousness, restlessness, and especially rebound nasal congestion if prolonged use. There's a lot of people out there who use Afrin every single day of their lives, just because when they stop using it, their nose stuffs up. It can also have interactions with things like caffeine, MAOIs, and beta blockers. Intranasal glucocorticoids. These have anti-inflammatory properties used to decrease rhinorrhea, sneezing, and congestion, but also have side effects with things like headache, blurred vision, irritated and dry nasal mucosa, hoarseness, nausea, vomiting, and insomnia. Antitussives. These act on the cough control center of the medulla to suppress the cough reflex. And they come in two different types, non-opioid and opioid. Expectorants. These loosen bronchial secretions, allowing the mucus to be eliminated by coughing, having side effects that include things like drowsiness, dizziness, nausea, vomiting, and diarrhea. Sinusitis and pharyngitis. This is inflammation of the mucous membranes of the sinuses. Treated with things like decongestants, acetaminophen, fluids, rest, and antibiotics. It can also be that inflammation of the throat, sore throats, treated with things like saline gargles, lozenges, and increased fluids. Before giving these decongestants, we want to determine whether the patient has a history of hypertension and keep a careful eye again on hypoxemia and decreased gas exchange. When using these nasal decongestants, we want to closely observe the color of the bronchial secretions, teach the patient the proper use of these sprays, and again, teach the patient to avoid prolonged use, to avoid rebound congestion. These patients will become dependent on these nasal sprays as a way to open up their nasal passages. For our first practice question, a patient is receiving an expectorant. Which symptom indicates to the nurse that the drug is exerting its therapeutic effect? That be A, bronchodilation, B, decreased coughing, C, loosening the bronchial secretions, or D, a relief of nasal congestion. And that answer is going to be C, loosening the bronchial secretions. For our second practice question, this is a select all that apply. The nurse is teaching an older adult patient about guanfacine. Which information is appropriate to include in this teaching? That be A, take the drug with a glass of water, B, read labels on over-the-counter drugs and check with a healthcare provider before taking cold remedies. C, take the drug at bedtime. Or D, advise the patient to contact the healthcare provider if the cough persists for more than 2 days. That answer is going to be A, take the drug with water, as taking it with a glass of water can help loosen those mucus. And B, read the labels on over-the-counter drugs and check with your healthcare provider before taking these cold remedies, as there could be a lot of different drug interactions related. Just because it's an over-the-counter medication does not necessarily mean it's just benign. For question 3, a patient's been diagnosed with a common cold. Which drug should the nurse question if it's ordered to treat this patient? Would that be A, antihistamines, B, antitussives, C, expectorants, or D, antibiotics? And that answer is going to be D, antibiotics. For question 4, which medication is a first-generation antihistamine? Would that be A, cetirizine, B, fexofenadine, C, diphenhydramine, or D, loratadine? Diphenhydramine, or Benadryl, also possibly your most common and well-known antihistamine. When teaching a patient about use of nasal decongestant sprays, the nurse informs the patient that they are most effective and less likely to lead to rebound congestion when administered for how many days? That'd be A, 3 days, B, 10 days, C, 14 days, or D, 20 days. And that answer is going to be A, 3 days. I can't stress enough how many people out there use Afrin every single day. Your body can become dependent on it very quickly. And while not like an addiction such as, say, heroin, the body is addicted and dependent on that to open those nasal passages. Question 6. Which of the following history is most important for the nurse to assess before administering diphenhydramine? That'd be A, an allergy to penicillin, B, hypertension, C, diabetes mellitus, or D, closed-angle glaucoma. And that answer is going to be D, closed-angle glaucoma. Because of its anticholinergic effects, it can exacerbate that increased pressure within the eyes. And for question 7, which statement about benzonatate does the nurse identify as being true? That'd be A, it's an opioid antitussive, B, it suppresses the cough center of the medulla, C, it suppresses respirations, or D, it causes physical dependence. And that answer is going to be B, it suppresses the cough center of the medulla. But anyway, that's all we got for this chapter. I'll see you in the next slides.